Tips and Pearl Summary. Treatment with VelaShape 3 is comfortable and effective when you remember the 3 simple T's: temperature, time on tissue, and tolerance. Always begin by guiding your patient through the 1 to 5 comfort scale, as discussed in the circumferential reduction protocol, and communicate with your patient throughout the treatment. Maximize parameters depending on patient's tolerance, and apply more spray, reduce stackings, or move to single pulse mode, or reduce RF even for a short time when absolutely necessary. You may be able to slowly increase the RF again once the patient becomes accustomed to the heat. Use your thermometer to ensure you are achieving endpoint temperatures. You should reach 43 to 45 degrees Celsius in all protocols, with the exception of the small area circumferential reduction protocol, which is 40 to 43 degrees Celsius. Maintain excellent applicator-to-skin contact at all times. Glide or move only when the vacuum has fully been released, so that the energy is deposited as deeply as possible into the tissue. Never lift the handpiece off the tissue before releasing the foot pedal or trigger. If the patient feels heat, simply glide to the adjacent area while releasing the trigger. Then you may lift the applicator and examine the area before proceeding. Use Vela spray and reapply frequently, but in thin layers, in order to facilitate the treatment and maximize comfort. Be sure to use Vela spray, which is the optimal medium, and additionally provides beneficial ingredients such as caffeine and carnitine. Note that use of other non-specified products may produce unwanted adverse events and may be detrimental to the device. Additionally, damage to the device caused by these other ingredients may not be covered under service contracts. Position the patient so that you have the maximum amount of tissue and a flat workspace with the most surface area possible. This will ensure a comfortable treatment for both the patient and the operator and will minimize bad coupling or poor contact issues. Proper positioning will also allow you to treat smaller or more difficult to reach areas more effectively. Avoid treating directly over bony areas that are not adequately covered by tissue. And finally, be comfortable. Good results come from properly executed treatment protocols. Make sure you are comfortable by adequately positioning the patient and then utilize the improvements in VelaShape 3 to your benefit. Hold the applicator comfortably. Set the parameters on the handpiece if desired, and use the foot pedal.